Should children be given the vaccine? Our guest, Dr. Tony Hinton, doesn't think it's necessary. He was a consultant surgeon with the NHS for 30 years, and although he believes in vaccines in general, he's totally against giving children the coronavirus vaccine, and we'll find out why in a moment. We're also joined by Dr. Julian Tang, a clinical virologist at Leicester Infirmary, who takes pretty much the opposite view. Welcome, both of you, to The Nexus. Dr. Hinton, perhaps I could start with you. Why are you against children being given the coronavirus vaccine?
Well, let me just make clear, first of all, my own vaccine history. I've had every vaccine I have. I've had more than most people as a surgeon, things like hepatitis B, because people don't need that. I've had both my doses of Pfizer. My children have had all their childhood vaccines up until including HPV, so I'm not anti-vaccine. I've got two worries about this particular COVID vaccine. The first is children really do not suffer in any bad way from COVID. They suffer the least of any part of our population. So there is very little, if anything, for children to gain. There's no benefit. So any new medical treatment will have a risk, no matter how small that risk is. There's no point in taking that risk if there is no benefit. My second worry is that if there are some deaths from this COVID vaccine in children, not only will it put a stop to this COVID vaccination programme, but it could actually set back by years our very, very successful children's vaccination programme, which really is one of the best in Europe or the world. And that is for diseases, polio, mumps, rubella, that can have devastating consequences, even death, for children.
But why do you think there are risks for children taking the vaccine?
Well, there are risks. There are always risks. Any medical treatment, a medicine, a vaccine, an operation. When I do an operating list, I have to consent each patient about all the possible risks, and the patient makes an informed choice.
Are you relying on any specific data?
There's two sorts of data for. There's a recent Pfizer trial that is going ahead that appears to show some negative consequences, shall we say, for children. It's not fully published yet. It's updated every few months. There's only 2,000 children in that yet. And the safety data for that COVID vaccine is continuing for the next 2 years. This vaccine at the moment only has an emergency use license. There are two particular pieces of evidence that we've looked at. One looked at possible pulmonary emboli in children, and it looked as though there were maybe 2 in 1,000 children. That could possibly lead to 100 deaths in the UK. We've also looked at Pfizer lethality in adults, and that looks to work out as about 1 in 61,000. And if that was similar in children, again, 5 million children being vaccinated at senior school, that would work out somewhere about 81 child deaths. But let's face it, none of us want even one child death from this COVID vaccine that children don't need. Even one child death that is unnecessary could not only finish this vaccine programme, but adversely affect those other very important vaccine programmes that are important for children.
Dr. Tang, every parent will be listening very, very closely to this, because they'll ask themselves, why, if the coronavirus cannot harm my child who does not have underlying health conditions, why should you take even the slightest risk by administering the vaccine to a child?
So I'm not completely opposed to my colleagues' views, but I think our assessment of the risk of COVID is slightly different. We know that about 5 to 10% of children who get COVID, even otherwise healthy children, do develop these long COVID symptoms that may last for some time, at least 12 weeks or more, where they are quite debilitated. They can't walk, they can't get out of bed, they can't think. They can't go back to school very easily. And in adults, this long COVID is probably around 10 to 20%. And that's much more firm in terms of what we know, because there's just been more adults with COVID that we've been following. The risk of the vaccine, I mean, every vaccine does have some risks, and there are some local and systemic reactions to the vaccine from the small Pfizer trial that has been published in the New England Journal of Medicine recently. But again, they have to be weighed against the local context of what has been seen with complications from the COVID infection in children. So I think that different populations will have different balances of the benefits and risks for these vaccines. And for example, if you look back at the history of vaccination in children, most of the vaccines have actually worked very well. There have been some notable exceptions, for example, like the 2009 Pandemrix vaccine that caused narcolepsy in children from Finland and Sweden due to a particular HLA gene that they had, that they shared. And there have also been historically the problems with the rotavirus vaccine back in the 1970s and the RSV vaccines back in the early 60s, 70s, where it showed enhancement of disease rather than protection from disease in those two vaccines, rotavirus with interception and RSV with enhanced complications from vaccine antibodies.
Dr. Tang, I'm sorry to cut you short, but it's very important from parents' point of view. You know, they're very anxious right now. They're saying, should my child take the vaccine or not? And you're saying, on balance, they should take it?
So on balance, I think the children will benefit from the vaccine.
Right. And Dr. Hinton, what Dr. Tang was saying is that, you know, you can also suffer, it's not just about death, it's also about long COVID. So, you know, at least you can protect them from that.
I think the short answer is, would you prefer your child to have long COVID, or would you prefer your child to be dead?
I don't think Dr. Tang is convinced by that. You can have a quick rebuttal.
Well, if we talk about, let's talk about long COVID. There was a recent German study looking at, I think it looked about 1,500 school children, and they assessed the symptoms of all the children over weeks and months. And they were also testing the children to see who was positive for COVID and had it, and who hadn't had COVID. And I think I sent you a slide of this.
Yep.
And when you looked at the list of symptoms, there was virtually no difference in the symptom scores between the children that had COVID and the children that hadn't had COVID. But Dr. Tang has already said this may be a self-limiting condition that perhaps lasts up to 12 weeks. So for something that gets better with either no treatment or symptomatic treatment, is that worth risking any child that might die from what I would say is an unnecessary vaccine, this particular vaccine?
Dr. Tang, we are running out of time with both of you now. Two short answers, please, if you would. We've been talking about the manhunt in Belgium and people's distrust of governments and also of scientists. I'm not saying a majority, it is a minority, of course. Do you think that the governments around the world could have done better in explaining the whole situation and winning the trust of their populations? And if so, where could they have done that?
Yes, so I think the government messaging may have been too black and white in some cases. If there's uncertainty, the government needs to make this clear, rather than saying that we can definitely do this, we can definitely do that, or this definitely doesn't happen, this definitely can't happen. I think that has caused some mistrust in the public, especially when those things that they said can't happen have actually happened. And with the vaccine, I think the vaccine messaging has been much better. But of course, it can be improved somewhat. But the thing is, the data is quite uncertain. So the messaging can't be more certain than the data, unfortunately.
Well, Dr. Tang and Dr. Hinton, thank you both for your contributions. We could talk much further about this, but unfortunately we have run out of time. And thank you at home and on your phones for watching. Remember, if you want to see this or any of our previous episodes, do go to our channel on YouTube. Just type in Nexus TRT World. Until next week then, goodbye. Well, thanks for watching our program. If you liked it, please give it a thumbs up, share it with your friends and family, and even subscribe.